So I'm going to start out on the outside of my patient's room, checking their orders and seeing that they're due for a tracheal suctioning. And before I head into the patient's room, I'm going to gather my supplies. I'm going to get my tracheal suctioning kit, my sterile gloves, the sterile saline, and a towel for the patient. And then I'm ready to enter into the patient's room. Knock, knock. Hi, Mr. Smith. My name's Nicole. I'm going to be your nurse today. I'm here to perform a tracheal suctioning, provide privacy, do my hand hygiene. Before I get started, I'm just going to identify your name and date of birth. If your name's John Smith, could you please raise your hand? He raises his hand. Is your birthday February 1st, 1997? He says yes. He raises his hand. Okay, have you ever had a tracheal suctioning performed before? The patient denies. So before I get, the tracheal suctioning is used to help secrete some of the mucus and fluid that is built up in your lungs. And after the procedure is done, your O2 levels should be going up, so it should be easier to breathe. So before, I'm going to assess some of his vitals. I'm going to check his O2, his lung sounds, and his heart rate. And I see that his O2 is at a low level at 86%. And I'm going to auscultate his lungs bilaterally, and I see that his lungs have some crackling and some gurgling. So after the suctioning is done, that should be clear. And I see that his heart rate is normal and regular. And I'm going to apply a towel around the area, and I'm going to raise the patient up to semi-Fowler's position. And also I'm going to turn the suctioning on to 80 to 120 millimeters of mercury, and I'm also going to hyperoxygenate the patient at 12 to 15 liters of oxygen to help hyperoxygenate him before the suctioning. So the procedure may be a little uncomfortable for you, so if you need me to stop at any moment during the time, and if you feel the need to cough, it's totally okay. And I do encourage you to try to deep breathe as we're doing the procedure. And then if you're feeling uncomfortable at all, just raise your hand and let me know. So I'm ready to start the procedure. I'm gonna get my kit ready, and I have my sterile saline. I'm going to open up the cap of the sterile saline so it's loose, and then I'm gonna get my kit and I'm going to open it up. I'm going to open up the kit. Apply my sterile gloves. And now I'm going to set up my box in the sterile field. Next, I'm going to get my tubing. Okay, so I got my tubing. I'm going to punch it up so you don't break the sterile field. And now I'm going to get my my sterile saline. I'm going to break sterility, and I'm going to pour the water into the tubing, or into the cup. And then next, I'm going to get my tubing from the suctioning. And with this hand, I'm going to attach the suctioning to my tubing. And after that's done, I'm ready to prime and lubricate the tubing. And I'm going to, and I see that it's suctioning and it's ready for the patient to be suctioned. So I'm going to come over to the patient. I'm going to explain to Mr. Smith that I'm ready to start suctioning. I'm going to be removing the oxygen, and that it should only take a couple seconds. So I'm going to remove the mask, and I'm going to make sure not to touch anything. And I'm going to enter it about 5 inches, and once I feel it resist and him start to cough, I'm going to suction and pull out the tubing, not breaking. And then I'm going to put the oxygen back on the patient. I'm going to wait about 1 to 2 minutes and have him get oxygenated. I'm going to recheck his heart rate and the O2 stat. I see that the O2 stat has gone up to 90%, and that's still not enough. So I'm going to want to resuction Mr. Smith again, and I'm going to let him know that I'm ready to resuction again. And I'm going to be priming the tubing once again with the water, and I'm going to suction, and then I'm going to come over, I'm going to remove his oxygen, and I'm going to insert the tubing, making sure not to break sterility, and I'm going to put 5 inches, and once there's tension, and him start to cough, I'm going to suction out and then reapply his oxygen. I'm going to wait about 2 minutes, and I'm going to see that his O2 stat has gone up to 96, which is at a good percentage for him to be fully oxygenated. And I can see that he does not need to be suctioned again. And at this point, I can take off my gloves, and I'm going to turn his O2 stat back down to the doctor's orders of 2 liters to 4 liters of oxygen a minute. I'm also going to auscultate his lungs again and check his heart rate, and I see that the heart rate's normal and that the lungs have no crackles and no gurgling, so I can see that the suctioning was successful for the patient. And then I'm going to make sure that he's doing okay, make sure that he's comfortable. I'm going to keep him in the semi-Fowler's position. I'm gonna leave you your call light here, so if you need me, just hit it. I'll be back in about 20 minutes to check on you. Lower the bed down, make sure side rails are up, perform hand hygiene. And then if you need me or anything, I'll be out in the hall documenting what your tracheal suctioning. So if you need me, just hit the call light. And I'm gonna come out and I'm going to document and say that the suctioning was performed, and that at the beginning his O2 stat was 86%, and after the first one it was not successful, and I performed 2 suctionings. You do not want to perform more than 3 suctionings, but since his O2 stat was at 96 after the second suctioning, it was successful, and the patient tolerated it well, and yeah, so that's all.